Hi, I'm Dr. Kyle Cassas, a primary care sports medicine physician with the Stebbin Hawkins Clinic of the Carolinas. Today I want to talk to you about overuse injuries in the endurance athlete, specifically relating to runners and triathletes. Endurance sports place unique demands upon the body. It's because of the amount and volume of training that goes into those sports that overuse injuries can occur. It's very frustrating for any athlete to deal with an injury, and that may lead to missed training and missed competition. Part of our job here at the Stebbin Hawkins Clinic is to recognize your injury and identify some of the risk factors that may have led to that injury in the first place. Risk factors for overuse injuries are many. I want to go over some of the critical ones. The training load, specifically frequency, intensity, and volume, are very important to look at. Really, it comes down to doing too much too fast, and so it's important to gradually work in to the type of training that you're doing, and oftentimes a coach is necessary to help you create an appropriate training program with the appropriate volume and load. The types of training that you do can also affect your rate of injury. Specifically doing speed work and some hill training, oftentimes that can place significant demands upon the body. The training surface is also very important. Specifically, if you're training on harder roads or hard surfaces, that can lead to a lot of stress to your lower extremity. Biomechanical issues such as altered gait or running economy can be an issue, and that leads to, again, increased stress on the lower extremity, IT band, the knee, the foot and ankle, and those issues are oftentimes something that we can look closely at. Any type of equipment that you're using for training can often contribute. And the big things really are muscle weakness, muscle imbalance, specifically in the core musculature and the hamstring. And really the number one risk factor in talking to patients really is any type of history of previous injury. And looking specifically at some of the injuries that are common, the lower extremity in a runner is obviously the most common. We'll look at the knee and conditions like patellofemoral pain, tendinitis, which will be pain in the front part of your knee. Lower leg conditions such as shin splints, which again is related to running on hard surfaces. Stress fractures can also be a part of that or component of that. Pain continues and you're starting to have pain both at rest and at night. Achilles tendinitis is also very common. And something else that we'll often see related to training is something called exertional compartment syndrome, and that's something where you'll have pain, swelling, and tightness in the calf associated with exercise. Other conditions that we'll encounter in the lower extremity include foot problems such as stress fractures, again, metatarsalgia or pain in the ball of the foot, sometimes neuroma or even plantar fasciitis. I want to go over a few other areas that are specific really to runners. Those things include really your foot type. Are you flat-footed? Do you have a high arch? And what type of shoe do you need? Oftentimes you may need a motion control shoe if you're flat-footed, sometimes a more neutral shoe with the appropriate orthotic. And if you're high arched or have a rigid foot, then again you need more of a cushioned type shoe. And so it's going to be important to look at those factors in dealing with these injuries and recovery. It's going to be also important really to seek out guidance from a local store that can help you look at your foot and get you teamed up with the right shoe. Other factors that are also important for runners are going to be looking at your glute strength, and so weakness of the glute medius, which is a muscle very important to running, and also looking at flexibility, flexibility of the hamstring and your quad and your calf and Achilles. And so all those areas are going to be something that we're going to look for here in the office, but also in physical therapy. Next, we really want to talk about some of the active recovery techniques, and this is very, very important. You want to remember to warm up appropriately and also cool down after your activities, and that can be something as simple as just a 5-minute walk or some spinning on a stationary bike or your trainer, just to let the muscles cool down, and it can make a big difference. Icing really needs to be your best friend, and that can be ice bath. I like ice cups where you can massage the area of pain or soreness or area of injury to help reduce inflammation and recover from injury. Stretching is very, very important, and I like to tell patients really to stretch after exercise, but if someone likes to stretch before, that is fine, but really afterwards I think is probably the prime time to do that. A lot of athletes like to use massage for recovery. That helps improve blood flow to the area and repair some of the muscle and tissue damage that occurs with exercise and training. And don't forget your nutrition. Recovery nutrition is very, very important, and specifically your hydration. It's important to replace some of the fluids that you've lost during exercise and some of the electrolytes, and also getting a carbohydrate source of nutrition within 20 minutes is important to replace the glycogen stores that you've lost during exercise, and that'll help you really for your next training and your next competition. Again, so the take-home points and some of the important concepts from today's video is really need to evaluate where you are in your training. Are you having any aches and pains or any problems that can contribute to an overuse injury? Getting a solid foundation in the off-season is critical, and that has to do really with some specific exercises that you can do and flexibility. Getting appropriate sleep and rest throughout training and competition are critical. That's the time that your body uses to recover and repair tissue damage. And again, when you're training, you really want to avoid any significant pain. If you're having pain, that's your body, again, telling you that something is wrong. Cross-training is something I also recommend to athletes. With a triathlete, that's simple. That's something they're doing all the time. But for a runner, they may not swim much, or they may not ride a stationary bike. They may not do any rowing. Those are all very good activities for a runner to do cross-training once a week, twice a week throughout their training. And don't forget to strength train. Strength training is oftentimes something that endurance athletes are maybe afraid of because they don't want to get bigger and bulky. And again, but you need to strength train. It's something very important, not only to reduce injury, but to improve your overall body composition. Overuse injuries are very common. The good news is that almost all of these can get better with the appropriate rest and treatment. So it's important to listen to your body, try to stay ahead of these aches and pains, and always consult your physician if some of this becomes much more painful than just soreness. And again, have fun out there while you're training.